So for a company to say buy this and don't use products containing minoxidil is what is so wrong, because they're telling people not to take proven medication, doctor advised medication, just to sell their product. If you are a young man suffering from hair fall and you spend time on Instagram, it is quite possible that you will be bombarded by ads for hair fall from all sorts of companies. And you might be confused on what is good, what is bad, what you should follow, what you should not follow. Today I'm going to talk about how, despite all this information available on social media, you should still consult a trained doctor for your healthcare needs, and how these ads can in fact harm you if you don't know better and if you are not careful. To discuss this, I am Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center in Eva Aesthetics, Bangalore. Now, I am a plastic surgeon who specializes in hair fall, and I post a lot of content regarding hair fall on social media. Because of this, I get a lot of ads from various companies that are also in this space. And till recently, these ads are quite harmless. Companies were promoting their product, asking you to buy it, fair enough. But recently, there has been a trend where these ads are getting more and more aggressive, more and more nefarious and problematic. And that's what I wanted to talk about. Today I'm going to give you two examples of ads that I saw which really can do a lot of harm if taken out of context. So it all started with this ad which I saw a few weeks ago. This is by a company promoting their product which has rosemary oil, Redensil and Procapil. Now that in itself is not much of a problem, but the problem is this ad that they showed which said, do not take drugs containing minoxidil. This is a very shocking statement for a company to issue. Why? Minoxidil is one of the 3 FDA-approved medications for hair fall. It is the foundation of hair fall treatment, minoxidil lotion. So, to say that you're telling people not to take this when it is literally one of the few products that we are confident of and is approved just to sell their product is what is so irresponsible. Let us understand this a little bit more closely. Now, they claim that their product is 100% proven and they are quoting one journal article to show this. But if you do a PubMed search, which tells you about all articles published, you will see that their compound, what their formula contains, Redensil has just one article written on it. Procapil has just one article written on it. And again has just one article written on it. What about minoxidil? Minoxidil has thousands of articles written on it. So this is where companies can twist sentences and say that it is scientific evidence and evidence backed. But one article does not mean evidence. A company can fund a paper and get one article published on almost anything. But for it to be called evidence, there has to be a body of work. Minoxidil fits in that criteria. It has been extensively studied. We know what it does, we know what it doesn't do, we know what its side effects are. And in the case of minoxidil, the side effects are very minor. It might cause a little bit of itching in some people. Other than that, it's a very safe drug and it can be taken very easily and it should be taken. So why would the company do this? The company is doing this because they wanted to buy their product. And their product is over the counter. You don't need a doctor's prescription for it. Now here again, let me clarify something. Redensil is a drug that we also prescribe, even in our clinic. I'm not saying it doesn't have a role. I'm not saying you shouldn't take it. But it is not the main medication. It is a supportive medication that you give in some patients. So for a company to say buy this and don't use products containing minoxidil is what is so wrong, because they're telling people not to take proven medication, doctor advised medication, just to sell their product. So that was the first example. Now let us look at the other example, which is on the other extreme, the other end of the spectrum. Soon after I saw this ad, I saw this ad by a different company. Here they're promoting minoxidil, but they're telling you to buy lotion minoxidil and oral minoxidil in their tablet form. And they're saying that this is safe and easy with no side effects. Everyone should be able to use this. So what's the problem here? Doctor, weren't you just saying that minoxidil is the foundation of treatment? Why? What is wrong in this advertisement? The problem here is oral minoxidil. Minoxidil has been approved for the treatment of hair fall as a lotion form, not as a tablet, not as an oral form. To understand this, let us go back to how minoxidil was first created. Minoxidil was first created as a tablet for lowering blood pressure. It was a blood pressure lowering medication. And when people took this tablet, they also found that their hair growth increased. So then they experimented and they came out with a lotion form of minoxidil which got FDA approval for treating hair fall. So you can obviously see what the problem is here. Oral minoxidil as a tablet is a blood pressure lowering medication. It is not something that anyone can easily take. You need to be checked to be made sure that you are safe to take this. People whose blood pressure is already low, they should not be taking this medication. In our clinic, we always check the patient's blood pressure and we get an ECG done of the patient before prescribing oral minoxidil. And oral minoxidil is something that we give in rare cases, in people whom we have tried all the regular medications first before we try oral minoxidil on them. Again, it is not something that you advertise freely for everyone to take oral minoxidil. So here I wanted to see exactly what this company was doing. Now this company's model is quite funny. You can pay for the medicine first and then the doctor's consultation happens. You've already paid for it. The consultation is kind of a formality. I don't know how this is possible or correct. That a patient can say, I want this medicine, I will order this medicine, a prescription only medicine, as if we're in the supermarket. But anyway, that's how it's happening. So once I paid for the medicine, I did a audio consultation with this doctor. This doctor is an MBBS doctor who was clearly reading from a script. And from that script, she asked me all about my hair fall. The script was not bad. She covered all my hair fall history properly. But she did not ask me a single question if I had any heart issues. She did not ask me what my blood pressure was. And at the end of the prescription, at the end of the consultation, she gave me a signed prescription for oral minoxidil, despite these glaring issues. Then I actually told her, look, I'm a plastic surgeon. What you're doing is wrong. You are just prescribing oral minoxidil, which is a blood pressure lowering medication to people without checking what their blood pressure status is. And then she realized what she was doing. Now, I'm not blaming the doctor in this case. She doesn't know better because she's just an MBBS doctor. I'm blaming the company. This is wrong for this company to be promoting a off-label indication for a prescription-only medication in such a free-flowing manner. So here you can see what extremes there are. On one hand, one company is telling you not to take the proven medication. On the other hand, the company is telling you to take a very aggressive medication, which is again not indicated for everyone. Why is this happening? Please understand that the company only wants to sell you their product. That is their bottom line. They sell product, they are happy. Whether your hair fall is treated or not, that doesn't matter to them. Whether you get side effects or not, it's not so much of an issue for them. So, what is the solution? Obviously, it is not. We cannot expect patients to sit and learn so much. What is oral minoxidil? What is topical minoxidil? This is not a patient's job. But what you should do is consult a qualified doctor and not go by Instagram ads or social media ads. Seek a plastic surgeon or a dermatologist with experience in hair fall treatment. Then you will get the right guidance. There is so many medications available. This is not one size fits all. Each person has to be judged and evaluated on their history, their other medical conditions, their aims and goals, and a treatment plan be advised accordingly. So, stay safe, do your research, do not play with your health by online ads. Always seek a trained doctor for your healthcare needs. Thank you.